So we didn't have a whole lot of updates to the exercise chapter. We just added a few extra, what do I want to say, like studies and things to back up our recommendations, because not much has changed in terms of what's recommended for exercise. So the American Congress of Obstetricians and Gynecologists, also known as ACOG, recommends that pregnant women get 30 minutes or more of moderate exercise on most, if not all, days of the week. I just say 30 minutes every day. Let's make it easy. All women without contraindications should include aerobic and strength conditioning exercises during their pregnancy. I also think pregnancy is a really unique time for positive behavior change. You can never have like a more motivated patient than a pregnant woman. So it's a really good time to encourage them to start an exercise program or continue if they are already doing so. Of course, you want to set reasonable goals for that patient. If they're completely inactive and they're overweight or obese, we're not going to recommend that they, start at 30 minutes of walking per day. That might be too much. You might want to start at 10 minutes a day and gradually work your way up. The key role of the health provider is to explain the benefits of exercise to the mother and child. A lot of women are afraid to exercise and they don't know that there's any benefits. A lot of women I see have actually stopped an exercise program because they think it's going to hurt the baby. You want to review the impact on blood sugar, really emphasize consistency. If they're walking 1 day a week instead of 3 days a week, they're going to see some differences in their blood sugar on that 1 day, especially if they're on medicines or insulin. It becomes even more important. You want to set expectations for the patient. So I try to set goals with all my patients. How much are you planning to walk? How many days per week? For how long? Where are you going to walk? Who are you going to walk with? Get as much information as possible. So then when you follow up with them, you can kind of hold them to what they agreed to do. Encourage record keeping. And I usually have them do that on their food log if possible. And then I reassess the goals. Maybe something has changed. Maybe they're having pain in their foot and they can no longer walk, and we have to move on to recommending some arm exercises with 1 or 2 pound weights. That's always possible. So, okay, glycemic benefits. It improves blood glucose control. Fasting blood sugar improves after 6 weeks. I even see it faster than that. It increases insulin sensitivity, so it's one of the few ways you can do that without medication. It increases glucose utilization, so of course your muscles are working, you need to pull glucose out of your bloodstream. And also improves carbohydrate utilization as the muscles use more glucose. Maternal benefits of exercise is it makes it easier to deal with the demands of pregnancy, like increased girth, increased lordosis. That refers to the arching that occurs in the low back, and the altered center of gravity. So, if a woman's coming in and she's having low back pain, you may want to take a look at how her posture is, especially if she's further along. If you think of the pregnant belly almost like a package, if you hold that package or a big box far away from your body, it's going to, recruit a lot more muscles from your low back to, keep you stable. If you think of pulling that package in close towards your body, it's a lot easier on your low back. You do that by pulling in your abdominal muscles. So I tell them to hold the baby in close towards your spine, like pull it back with you. It really makes a huge difference. Also, exercise can strengthen the pelvic floor muscles, which can make labor a little bit easier. Fetal benefits of exercise. This is so important. Exercise helps prevent women from gaining too much weight during the pregnancy. It really does, and that can prevent the baby from gaining too much weight during the pregnancy, which overall can reduce the risk of childhood overweight, childhood type 2 diabetes, and metabolic syndrome. As we know, these babies are at higher risk for it just because the mother had gestational diabetes. Contraindicated exercise would be anything that could result in abdominal trauma. I think all of these go without saying. You don't want something where there's a very jerky movement, a lot of bouncing, or rapid twisting. A controlled twist, like you're going to take dishes out of the dishwasher and put them in your cupboard, is fine, but something where you're twisting really fast and your center of gravity is a little bit off, that could tweak your low back. There's actually more contraindicated exercises listed on the ACOG website. For providers, they have a handout called Exercise During Pregnancy and the Postpartum Period, which is really helpful. It's a little bit lengthy, but it explains everything. And for patients, there's a downloadable PDF file, Exercise During Pregnancy, which also details, just the highlights of these. So that will go through, signs and symptoms to stop exercise and which exercises are appropriate, etc. I don't want to take too much of our time on this today. So in summary, pregnant women should engage in 30 minutes of total exercise every day. In the absence of medical or obstetric complications, you want to include both aerobic and strength exercises if possible. And there's many benefits for exercise, more than just controlling the blood sugar. So I highly, highly encourage it.